Hi, everybody. My name is Hussain Rao. I'm a tutor with MedSchoolCoach. I've been with them for about a year now and have been tutoring for both USMLE Step 1 as well as USMLE Step 2 CK. So today we'll be doing a question of the week, and it will be a Step 1 question. So let's get started. So I'll start by reading through the question, and then I'll give you a second to think about it before we move to the answer choices. And then we'll kind of go through each answer choice and see which one's right and why the others are wrong. So we'll start by reading it. A 72-year-old man comes to the office complaining of trouble breathing for the past 2 weeks. He states that he has never experienced these symptoms before. The patient is a lifetime non-smoker. He denies use of any illicit drugs, and the patient has a history of Hodgkin lymphoma and recently received multiple rounds of chemotherapy. Physical exam reveals bibasilar crackles on lung auscultation, JVD, and 2+ pitting edema in the lower extremities. What is the most likely cause of this patient's symptoms? So I'll pause there and give you guys a chance to think about it before we move on. Okay, welcome back. I hope that you had a chance to think about it and kind of take your time to piece together the diagnosis here. But we'll first do a quick summary. So here we have an elderly 72-year-old man who's coming in for a chief complaint of difficulty breathing for the past 2 weeks. He is a lifetime non-smoker, no drug use, and recently received chemotherapy. The physical exam seemed to provide us with many clues, showing bibasilar crackles on lung auscultation, JVD, as well as 2+ pitting edema in the lower extremities. So with that in mind, I think that we can start thinking a little bit down the track of cardiac pathology, because it seems like this is some component of heart failure or some kind of heart dysfunction, given that he has fluid on his lungs, JVD, as well as pitting edema in the extremities. So the first answer choice, adverse effect of bleomycin. So this requires us to call upon our pharmacology knowledge and remember our side effect profiles. So bleomycin is commonly used in the treatment of Hodgkin lymphoma. However, it's typically not associated with cardiotoxicity. Classically, the side effect profile includes pulmonary fibrosis, as well as skin hyperpigmentation. Although bleomycin may be associated with shortness of breath secondary to the pulmonary fibrosis, this would more likely present as a gradual onset dyspnea and not be along the lines of this decompensated heart failure like picture that this patient is presenting with. So with that in mind, we can effectively rule out the answer choice. Answer choice B says idiopathic pulmonary fibrosis. So this is somewhat similar to the logic that we just discussed about how idiopathic pulmonary fibrosis would more likely present as a sudden or a gradual onset dyspnea, and the physical exam findings are more likely suggesting decompensated heart failure. And the recent rounds of chemotherapy suggest that there might be an adverse reaction to another medication. So we can effectively rule out this answer choice due to the non-specificity of the symptoms and the acuity of the symptoms. So adverse effect of vincristine. So again, this is another cancer treatment that is used commonly in treating Hodgkin lymphoma. And vincristine is a vinyl alkaloid that's commonly used to treat Hodgkin lymphoma, solid tumors, as well as leukemia. And it does so by binding beta tubulin and inhibits the polymerization of microtubules. And classically, it's associated with neurotoxicity as opposed to cardiotoxicity. So the neurotoxicity of vincristine is most commonly represented in USMLE Step 1 questions by asking about peripheral neuropathy. So because we don't see that side effect profile here, we can effectively rule that one out as well. Answer choice D is adverse effect of cyclophosphamide. So again, cyclophosphamide is used in the treatment of Hodgkin lymphoma, but once again, it's not really associated with the cardiotoxicity we see here. In comparison, cyclophosphamide is associated with myelosuppression, as are many of the anti-cancer drugs, as well as SIADH and hemorrhagic cystitis. It's important to remember that the hemorrhagic cystitis associated with cyclophosphamide can be prevented by mesna. However, that is not really the picture that we see here. most commonly for USMLE Step 1 questions, the most high yield fact that is tested is that hemorrhagic cystitis, as well as the prevention of mesna, but it's not really what we see here in this vignette today. So finally, we're left with answer choice E, which is the correct answer choice here, which is adverse effect of doxorubicin. Now, like we talked about before, many of these medications were used to treat Hodgkin lymphoma, and doxorubicin is as well. However, doxorubicin is the only answer choice here that would have a side effect profile that will present potentially with heart failure-like symptoms, where we have this fluid in the lungs, JVD, as well as a pitting edema. With that in mind, we can get into the explanation for this question. And like I mentioned, this patient is likely suffering from drug-induced cardiomyopathy, and specifically dilated cardiomyopathy, as an adverse effect from the chemotherapeutic drug doxorubicin. So this drug was likely related to his recent rounds of chemotherapy that he received for Hodgkin's lymphoma. And there are two commonly used regimens to treat Hodgkin lymphoma in the United States. And the common mnemonic for them, or the common phrase for them, are the ABVD and the BCOP regimens. So the ABVD regimen includes adriamycin, which is another name for doxorubicin, and bleomycin, vinblastine, and darbazine. The BCOP regimen includes bleomycin, etoposide, adriamycin, which is again doxorubicin, cyclophosphamide, oncovin, or also known as vincristine, procarbazine, and prednisone. Now, it may not be important to memorize these regimens specifically, but it is very important to recognize their side effect profiles, like we went through with each of those drugs during the review of the question. Now, doxorubicin, like we mentioned, is associated with cardiotoxicity that results in a dilated cardiomyopathy, alopecia, and potentially myelosuppression. So dilated cardiomyopathy will lead to a decrease in cardiac function that may present as this decompensated heart failure picture that we saw in the vignette today. The physical exam findings demonstrated heart failure through the blood pooling in the lungs, the jugular veins, as well as the lower extremity. Another thing to keep in mind is that Doxorubicin is an iron chelating agent that can be used to prevent doxorubicin-induced cardiotoxicity. So sometimes that is asked about, but more frequently, the side effect profiles of all these medications are really high yield for USMLE Step 1 exams. So in quick summation, bleomycin is the characteristic side effect profile will be pulmonary fibrosis and skin hyperpigmentation. For vincristine, we said was more likely the neurotoxicity, and that will present as peripheral neuropathy. Cyclophosphamide is most characteristically SIADH, or hemorrhagic cystitis. Keep in mind that the hemorrhagic cystitis can be prevented by mesna. And finally, doxorubicin, which we talked about today in the context of decompensated dilated cardiomyopathy. So I hope that was helpful, and that was our question of the week this week. Thank you, guys.